Yeah, I was ranting about, private care and where we're going. I think as government healthcare takes up more of the marketplace, we're going to be forced to find new alternatives to shunting people away from Medicaid and giving them alternatives in the marketplace. Even if we have to subsidize them, this would be a better improvement over the Medicaid system that we have today, which is a complete disaster. I mean, and liberals are very much against letting poor people have choice and letting poor people make choices for themselves. I think it's going to be very interesting to see if conservatives can tap into that and show that poor people can make cost decisions as well as anybody else can in this society.
Well, we have very good proof of that already in that when we're looking at situations like the welfare cliff, where you have a level beyond which it becomes unprofitable to obtain a job because it can't at a certain level compete with public assistance. You've seen that chart. We've all seen that chart about the welfare cliff that once you get to a certain point, benefits just are more, you get more and you can take care of more by not having a job, the benefit. People in poverty make economic decisions that are right for themselves every day, and that is one I have always argued that has been a proper financial decision for a person in poverty to make, provided that they don't have the idea that they need to work for some self-realization reason. They make economic decisions quite skillfully every day. It's not an economic ignorance issue of general economic principles. It might be a lack of understanding of the details of this particular situation.
I think that's right. I think we've I mean, obviously healthcare is a very complicated thing, but at the same time, we make it out, the one of the reasons why it's become overly complicated is because the government system is forced to become overly complicated. I mean, you look at the billing system, there isn't a physician in this country that can explain it to you. Talk about an absurd system where neither the provider nor the customer can explain what costs are or how the payment system works. Until we simplify that and allow people, understanding of what they're actually paying for and what they're getting for that money, we're always going to have a distorted system.
It's the question mark, question mark, question mark between get healthcare and profit. That's what we need to work on eliminating.
Well, and I think we could use the business model that we can look at is veterinary medical care, plastic surgery, eye laser surgery, those things where the costs keep coming down year after year. Technology is improving. The customer makes decisions, and the customer and the doctor are very close to one another. They make financial decisions and care decisions, and it's because there really isn't that not so invisible hand of the government in the middle of things. And it's not because and it's not scary, totally unregulated. Plastic surgeons are quite heavily regulated by the government, and their procedures have to be safe, and you can sue them if things go wrong. It's just that because they're voluntary decisions, the doctors have to compete for your business. So they provide more and better services every year at lower and better prices. And that's free market healthcare.
Yeah, I think you're seeing it with concierge healthcare, and you're seeing a lot of innovation now because people are forced to do it because otherwise, the way Obamacare is structured, there's no way we can afford this overburdensome system anymore. And so in that sense, I'm actually kind of optimistic. I think this is a chance for conservatives to show, look, we can develop a free market system that will give poor people, middle class, wealthy people all more choice, and at the same time, hopefully reduce costs in ways that we haven't even thought of yet, mainly because government has been restricting us from doing these things. And so I think this is a moment for conservatives to really step up and provide plans. And I think the GOP really does understand this. I think in small ways they're looking at how can we, with Obama still in power for 2 more years, how can we make small shifts in this program to slowly move us away from this disaster? They're looking at, how to roll back the mandates, looking at how to roll back certain taxes. All these things, they seem small, in the short run, but long term, what we're slowly doing is pointing the whole system away from a government-centric, monopoly where Medicare and Medicaid really dictate what we do, and move it more to a personal choice issue, which is where conservatives really should be anyway.
Well, we've had a lot of conversations at my workplace because our insurance plans are being overhauled too. Not nearly as much as Ryan's, but one of the things that I've found to be really effective as far as talking about choices is, why does health insurance have to be tied to your company? Why can't you decide whatever kind of plan that you had? If you really like working with United Healthcare and that's always worked with you, but you decide to leave your company, why can't you take that with you? Just like the car insurance idea. Why do I have to have insurance that's decided for me by my company? Why can't I just go out and buy health insurance the same way I buy car insurance? I can buy what I need, I can afford for what I'm going to use. And it's been really interesting because I have coworkers from all different backgrounds, and a couple of them have shut me down, but then they've come back later and they're like, that made a lot of sense. I really think that's a good idea. And the other thing that they've all started talking about is health savings accounts. Because they're like, well, if we could have had health savings accounts back when we were in our 20s and we never used insurance, I could have $100,000 in my health insurance plan, or my health savings account now that it's been 20 years later, and then I wouldn't really need as much insurance. So it's been a really, really good conversation starter, and they're thinking about it totally differently.
And this is where I think we can use a kind of a rope-a-dope strategy. And Pradeep is right. Over the next 2 years, Obamacare is not going to get repealed, period. Obama's never going to let that happen, and he's still the president. So talking about and getting mad at GOP elected officials who don't want to insist upon repeal and yet are working towards modifying it over the next 2 years, that's really a bad strategy. We need to be modifying it over the next 2 years and making it as harmless as we possibly can.
People understand that selling car insurance, anywhere across the country has made it more affordable. People can understand and relate to car insurance, and there are just as many variations.
Flo, and everybody's like, "Oh, I can get stuff from Flo, and she'll compare prices, and that's awesome."